Hi everyone, welcome to the 10th episode of Dose of Derm, a dermatology guide for medical students. My name is Emma Holjak.
And my name is Iryna Savinova, and on today's episode, we will be interviewing Dr. Nadia Kashetsky. Dr. Kashetsky is a first-year resident at the University of British Columbia, which she started after completing her medical school at Memorial University.
Prior to medical school, Dr. Kashetsky completed her Bachelor of Science in Kinesiology at the University of New Brunswick and her Master's of Physiotherapy at Queen's. Outside of medicine, Dr. Kashetsky enjoys running marathons and even ran the Boston Marathon this year. Without further ado, we are excited to introduce to you Dr. Nadia Kashetsky.
Thanks so much for having me. I'm really excited to chat about my journey. And thanks so much for doing this. I think it's great to hear different perspectives of everyone's application and process to dermatology.
Thank you so much for taking the time out of your day to join us on our podcast. I already said that, but we really do appreciate it. And we're so excited to have you here to share your unique journey about applying from Memorial to UBC. So to jump right into the questions, could you tell us a little bit about your medical school experience and then your journey to dermatology and how that came about?
Yes. So I am originally a Maritimer. So I grew up in New Brunswick, and then I left for a few years to do my master's of physiotherapy. And then I went back to Newfoundland, moved to Newfoundland for my medical school. So when I started medical school, I was just really happy to be there. Prior to medical school, I did physiotherapy and kinesiology, so nothing related to dermatology. And I actually had very limited research exposure too. Before starting. So when I started, I had no idea what I wanted to do. So in my first year, I just took time to get adjusted. I focused on making sure that I was passing my exams and getting settled, making friends in my first year, and then just shadowing different things that I thought that I might be interested in. So I shadowed a few things like anesthesia and GI, and I think, what else did I shadow? Rheumatology. And then I also shadowed dermatology more near the end of my first year. And I really liked dermatology, but I knew that it was really competitive. So to be honest, I was really nervous about kind of going for it. And I shadowed it I think in May or something, and then I put it on the back burner, and I was just no, I don't think that I would be a good enough candidate for that. And then I shadowed it again in the summer, at the beginning of the summer, and I was I'm just going to go for it. I really like it. So then I went for it. And there's three really big reasons that I really became interested in dermatology. The first one was just the impact that I had on patients. I found when I initially shadowed dermatology, the patients were so happy. And I remember going into a follow-up clinic and seeing patients and their skin was completely clear. And the dermatologist just told me this isn't going to be a good learning experience for you because these patients are clear. But when I walked into the room, the patients were so happy, and they just told me how much their life had changed with these new biologics and these treatments that dermatologists were using. And it was very exciting. So that was my first reason why I kind of went towards dermatology. My second reason is the day-to-day. Dermatology is a very high-paced, high-volume specialty, and that's really exciting. Appointments are really fast generally. And you can also do a mix between surgical and procedural and medicine. So it's really nice to have that variation. And then I also found, compared to some of my experiences in physiotherapy before medicine, I found the patient population in dermatology really motivated. And I really liked the population. So that's my second reason. And then my third reason is, as I started to get more familiar with dermatology, I started doing some research, and I was really excited about all these new therapeutic agents that are coming out, and this boom, this therapeutic revolution in dermatology. It's so exciting, and that was my third reason why I decided to pursue it.
I think that even just you sharing that approach to begin with is very wholesome and sounds very healthy. Not really knowing that you wanted dermatology right away is quite reassuring, I think, to a lot of us who maybe also started and just didn't really know what we wanted. But I do agree that there's so many good things about dermatology, especially like you mentioned with the new treatments coming about. They're quite revolutionary. I think for the longest time, a lot of things in dermatology you couldn't cure, but now it works so well that it almost feels like you do, like almost fully cures a lot of the skin conditions.
So we know right now, a lot of our listeners, residency applications are probably at the forefront of their minds. And so we wanted to hear a little bit about your experience about applying to residency and going through CaRMS. If you wouldn't mind, could you tell us a bit about how you started preparing your application and what your approach was for CaRMS?
Yeah, so I started preparing my application as soon as I decided that I wanted to do dermatology. So it was in the summer after my first year. And I just started applying. I just told myself that I would do everything that I thought was in my power to make myself like a good candidate. And I just really focused on myself, and like I didn't look at what other people were doing. And I think that was helpful for me. So like I did lots of things in lots of different domains as much as I could. So one big thing I think a lot of people talk about in dermatology is research. And I think research is like really good about like moving literature forward, but also so good to demonstrate like how you work with teams and like how your work ethic is, and also to meet people at different universities, and to work with like your peers as well. It's really nice. So research was a big part of my approach to my application, and you can do research in so many different ways. Like I did some case reports, you can do systematic reviews, like cohort studies, retrospective series, like if you're fortunate getting involved in controlled trials too. And with research, like what my approach to research, because I didn't really have any before, was I just PubMed like dermatology in Canada, and like my approach was seeing like I had no idea who the big names were or like who was producing research, so I just looked up people on PubMed, and like I sent some blind emails, and most of the blind emails like weren't accepted, or like people are just so busy. So I think like I didn't take it personally, and I just like kept emailing, and eventually someone gave me a chance at a review, and I just went with that and rolled with it. So that's the research side of things, like in regards to publications. And then also with research, like going to conferences, I also didn't know about the conferences. So I remember just like Googling the conferences, and like I found different ones. So like I went to one at Harvard, it was like a dermatology medical student symposium, and I just found that by Googling it. And there's like JEADB, there's AAD, CBA, those are popular ones that people go to, SRGC. So I just went to as many of those as possible, and presented at those, whether it was a poster or an oral presentation. And then also in research, there's different like scholarships and applications you can apply for. So you can just like Google dermatology scholarships, and depending on like if you have a connection or if you're part of a different like minority group, there might be different opportunities for you too. So you can just Google those. So that's one thing. And then otherwise, like I also thought it was important to explore like some advocacy and extracurricular activities. So I ended up getting word of the Canadian Skin Patient Alliance through a research project I was involved with, and I started working with them quite heavily. So that was a big thing for me. And they also have a really good resource where they have a bunch of affiliate members. So if you go to the Canadian Skin Patient Alliance's website, you can look up all their affiliate members. And if you have a certain patient population that you want to really understand their perspective, you could reach out to that specific group too. Like, for example, there's like a burn society, there's like a scleroderma society, there's a rosacea and acne society. There's so many different societies in Canada representing patients, and they do such good work. So you could get involved with them, and that's what I did. And then also like part of my application, another approach that I did was just like continuing to do things that I really liked. So like I run, so I just continued doing that, and then I ended up just like getting some awards for that. So you can just put that on your CV. And then if you have any other hobbies, like whatever makes you you is like very important, and you want to just keep doing what you enjoy. So I think that was another thing that was a big part of my application. Were there any other like specific questions like about like the CaRMS process that maybe I didn't answer?
I think that something that we actually had a question submitted about was, so you have all these experiences. How did you kind of communicate them within your essays? And then also, how early did you start preparing your essays to be able to coherently, put together all these experiences?
Oh my gosh. I don't know what other people's experiences were, but like for me, it took honestly months. Like I like wrote a draft. So I wrote probably like 10 drafts and they were just complete garbage by the time I got to something that's like I wanted to actually work with. So it took me a lot of time and I really like I'm glad I started early because I underestimated the time it took me and like the approach that I wanted to do. And I think it's so unique to everyone, like how they start their letter. And I think that's what makes a letter a good letter, is that it doesn't follow a format. It's like unique to you. And I think I started my letter, if I remember correctly, like with like a bit of a metaphor, because my dad's actually a painter and an artist. That's what he did for his job. And I like related that and like my childhood to dermatology. So I think it's like very different on how people do theirs, and there's like no one size fits all on that. But definitely start early and like don't be sad if like your first draft isn't your final draft.
That's good advice. So start earlier than you expect. Probably like what, months, right? That should be a safe bet.
Yeah, like I know that they push up the CaRMS deadline, but for me, I think ours were due like early January, and I think I started my letter seriously at the end of October or beginning of November.
So kind of still sticking along the same lines, because we know that you went to school within the Maritimes and then now you're on the West Coast, we were curious to know whether you had any sort of unique experience applying to a residency program at a school that wasn't your home school, and maybe just share your experience, whether there's anything specific you did within research or extracurriculars to match to UBC, if that was your first choice or if that just kind of happened as the process went on.
Think so when I started reaching out to schools, I reached out to several schools, and UBC was a school that I got a research project on, and then I just continued building relationships with people at UBC. And I just really liked the relationships I was building here. Like I found the department very supportive and the residents really supportive. And I did rank UBC #1, and I'm very fortunate to be here. And I think for me, like it was just demonstrating my work ethic and just like working really, really hard to produce different projects for people and just making sure that I was really like kind and like good to work with. And I think that a lot of the things are actually like soft skills that people, if people like working with you or not, because like they look at you as like, are we going to work with you for 5 years? And is it going to be pleasant, and what can you contribute to the program? So I think just my relationships, honestly, through research is what maybe helped me with my spot at EBC. But at the end of the day, like I really don't know. I wasn't present for the conversations that happened behind closed doors, and I'm really not sure. But that's just my guess.
That makes sense, and it's exciting that that's where you ended up. How is being in BC? I've never been, but I've heard nothing but great things about the province. I heard it's beautiful there.
It's stunning here. It's really great if you're like active. Like we're very fortunate. I wanted to live kind of downtown by the water, like around the seawall. So I just go for walks and runs on the seawall often. And yeah, it's a really great place to live. It's kind of like I say, like a bigger East Coast. So it's nice.
I was just saying, I actually got the chance to do like a big trip a few summers ago, and it was shocking to think that medical students and residents at UBC get to just be around the beach and mountains all day, and that's just their normal view outside the window. But here I am in Hamilton, and Hamilton's wonderful, but there's a little bit more gray. So it's definitely, the views are very, very different.
Totally. And I mean, Ontario is really lovely too. Like Hamilton's very lush, if I remember. But yeah, it's very different. So it's beautiful to live here.
yes, we have the greenery. I will say the greenery and the waterfalls. No mountains, but you know.
Okay, so the next thing we wanted to ask about is we're not sure if you decided to parallel plan or like look into any other specialties or consider that at all throughout the CaRMS process. And we were wondering if you were comfortable, if you wouldn't mind sharing like your thought process around parallel planning, whether or not that was something you considered or not.
So I think this is totally different for everyone. And I think like, I don't think someone can make the decision for you. I think it's important for you to make the decision for yourself, whether like what else you enjoy. For me, I did not parallel plan. I only applied to dermatology, and like I had applications, like I had reference letters for internal medicine, and I also had reference letters for pathology. But when it came down to it, like when I was preparing my actual CaRMS application, it was just so derm heavy that I just felt like I couldn't, in good conscience, apply to something else, because I don't think I would be like, I know a lot of people say you would be really happy in other specialties, and I think that definitely could be true. But for me, I think I would have been okay with non-matching and then reevaluating, just because my application was so derm heavy and I felt bad applying to other specialties because then my heart just wasn't in it.
I really liked that perspective. And I think too, like how you mentioned that you had like gave yourself that, if this match this year didn't work out, I really like that you gave yourself time. So you weren't just like almost like rushing into another specialty. Like you would have had that like buffer time to like really sit and think, whether it's applying derm again or applying somewhere else. So I think that would make like the match process, if it didn't go derm the first time, like a lot better and like a lot happier. So I think that's really great advice.
I think it's just personal preference. Like, I worked with someone actually in the States who only applied to derm their first year and they went unmatched. And then this year they went matched for dermatology in the States. So like I didn't think about applying to the States, but there's so many options, and I think it's really subjective to you. And I think that a lot of people get really scared, me too, about like the stigma of going unmatched. But like I think for me, I would have rather gone unmatched and had the time to reevaluate, like I said, than be pushed into something that I wasn't prepared for, because residency is really tough. And once you're locked in for a year at least. So yeah, that's just my opinion, but everyone definitely has different opinions on that.
I'm really glad that we are able to hear your perspective on things on the podcast, because I don't think we've gotten that side of things. And I think that not matching sounds incredibly intimidating and scary. And I think it's really helpful to hear that sometimes it can be a choice to give yourself the chance to have an extra year to explore something else or the same thing, should you want to. And it's not something that you should feel like you're forced into. It's for a lot of people, if they don't match dermatology the first year, it's kind of another opportunity to explore something else. So we kind of touched on this a second ago, but I kind of wanted to elaborate on this from a different perspective. So we've already heard how UBC is really lovely from the perspective of it as a school and being within a lovely province, but we'd love to hear a little bit about UBC's dermatology program and maybe how your first year of residency has been like, maybe something unique that you've discovered about the program that you didn't know before, anything that you'd like to share.
So I think like you don't really understand the program until you're like in it, so I think it's important to get perspectives from different schools. So for dermatology at UBC, we do have one block of dermatology in our first year, which is wonderful. We get to do a placement of community derm, but then everything else is off service. And I think that the off service that people do varies between different schools. Like talking to my friends at Toronto and McGill, I think it's very different. So for UBC, we do things that are like related to dermatology. So we do 2 blocks of pediatrics, 2 blocks of family medicine, a block of rheumatology or allergy, a block of plastics, emerge, psychiatry, infectious disease, and then general surgery, which I'm on right now. So it's a nice mix of things. And then in our second year, we don't have anything that's mandatory that's that off service. We have more electives, so we can choose things. So I've seen residents do, for example, like an elective in oral medicine or like an STI clinic. And then at the midway through our second year through our fifth year, it's all dermatology. So that's how our structure goes. And the specific details of the placements and electives that the upper years are doing, I'm not sure, honestly. I know they do some inpatient. I know there's several specialty clinics here at UBC, but the exact details of how many blocks of what they do, I'm not sure.
So overall, it seems like you're excited about the program as a whole.
Yes, I'm so excited about the program, and our PD, Dr. Allison Gregory, she's really lovely. She's very good with listening to the residents and like enacting change, and she's a big advocate for us, which is great. I feel really supported. And then also like with our group of residents, like it's really nice. It's technically like one of the bigger programs because we have 3 each year, and then in third year there's actually usually some re-entry spots, so the third year gets bigger. And like a couple weekends ago we all went to Whistler for a weekend and had like a bonding weekend, which was so lovely, and we often get together for dinners as a group of residents. So I really like my program and just like the dynamic of the program and the vibes of the program. I feel like it really meshes well with me.
I think that that's one thing that I love about the podcast is that we get to hear people gush about the residency programs, which makes the whole experience even more exciting. It's like the one thing that gets you through the CaRMS process is maybe thinking about how excited everyone is on the other side. Something that I did want to ask, because you just mentioned how diverse all the rotations are that you go through within your first 2 years of residency, do you ever feel like you get to apply some of your physiotherapy background to any of your rotations?
Therapy background. I definitely did, like going through medical school, like orthopedic surgery, I really did love. And I actually thought about maybe doing that too. But as I'm like going through these rotations, I feel like it is less relevant. Like sometimes things come up, but I find I actually like try to apply more derm on my off-service rotations than I do physiotherapy.
That makes sense.
And then one of our other questions we had for you is for students who are preparing for some of their dermatology electives, do you have any advice on how they can interact with the team and like their advisors just to maybe stand out and do a good job, things like that?
So my electives that I did, I was very, I think, fortunate to have like one-on-one with the staff because I did most of my electives, actually all of my clinical electives, like on the East Coast. So I wasn't interacting with residents or other medical students that were going for derm as well. So keeping that in mind. But I think it's just really important to be kind to everyone and like not be competitive like with other people, and like be really respectful to the office and the staff that you're working in. Like little things I find really matter. Like my feedback that I got, for example, on one of my rotations on the East Coast was like that it was really helpful that I went in and like set up my own biopsy trays and then cleaned the room after I did a biopsy. Like just simple stuff like that, I think people really appreciate. And like coming in, saying hi to the office staff, like getting to know them because they work here all the time. Like you're just coming in for 2 weeks. So it's really important to be very like kind and pleasant to everyone. I think that would be my biggest tip in that case. And then like clinically, I don't know if the other residents, they probably already told you like some resources that are helpful for electives, but like I purchased Bologna Essentials and I had that PDF on my phone. And I also had the big Bologna textbook on my phone so I could control F things on the go. And the new Bologna textbook, I think, is dropping this coming year. So that's very exciting. And then other textbooks like Dermatology Secrets and Fitzpatrick's, I also bought and had on my phone. And then there's a course that the AAD puts out. It's called the Basic Dermatology Curriculum that I found was really helpful. So I went through all of those lectures before I started my electives, and I found those really helpful. And then I also just like watched YouTube videos on how to do biopsies and like what to have on my tray and when to do what type of biopsy so that I could have that. And then I also tried to practice like on oranges and like on apples, like just downloading the kits or like getting them from Amazon and then like practicing like my shaves on apples. I found that really helpful. So those were some tips that I have.
That was really helpful. Actually, no one has shared any of those resources, maybe beside the AAD modules. I think those were all new, so that's definitely really helpful. And I'm going to go see that Bologna textbook for myself after this.
And I guess I have one other thing that I didn't mention that I think make you stand out is like if you see a case and it's interesting, like for example, I saw a case of acute skin necrosis after a certain drug. So like I went and I like PubMed like cases reports and then printed them out and then like presented them with my case to the staff. And I think that was like very appreciated to show some like initiative and like you're making sure that you like are finding these interesting cases and other cases like them and then presenting a plan of what other cases have done. So I think that's helpful.
That's very helpful for sure. So that brings us to our last big question of the episode before we get into the fun stuff, although this was fun, so I don't want to lead you astray. Okay, so we just wanted to kind of open up the space for any maybe piece of advice that you wanted to leave us off on. It could be about CaRMS or anyone applying to residency right now, or it could be about life, really anything.
Yeah, I think the biggest thing that I tried to stick with when I was going through the process, because it's so stressful, is just, and I mentioned it earlier, just focusing on yourself. I think that like if I focused on what other people were doing, I think it would really stress me out and like it's just not productive. It's just better to just put your head down and work in your own lane. And you can do like amazing things in parallel to what other people are doing and it doesn't affect you. So I think that's my biggest advice is just focusing on yourself and putting your best foot forward. Yeah, I think that would be my best advice.
That was great advice. Thank you so much. And then for our second kind of part of the episode, we like to ask our guests some rapid fire questions just so our viewers can get to know you a little bit more outside of medicine. And we have a classic question that we've asked all of our guests so far first, and that is just, what is your favorite skincare product?
My number one would have to be sunscreen. I personally like the La Roche-Posay 50 plus tinted sunscreen. And I've heard dermatologists say, like, if you don't use sunscreen, what's the point of using other things? So I think that has to be number one for me.
I love that. And I think that is by far all of the dermatologists that have come on the podcast. That's like consistently a favorite company. Like it's widely loved throughout the community, I would say.
Not sponsored though.
Yeah.
Sponsorship. So yeah, but that's my fave.
Okay, our second question is, what is your favorite place that you have traveled to in the past few years and why?
Place that we've traveled to. We went to this little cute community called Ravenna in Italy. It's like a city of art, and I really appreciate art because I grew up with my dad being an artist, and we ran a marathon there, like through the city of art, and it was so lovely. So that was probably my favorite.
Wow. Interestingly enough, my mom is also an artist, and she raves about her time in Italy with my dad, and they also brought art back. So it must be an art parent thing. Although I wasn't invited to the Italy trip, so I'm forever a little bit salty about that. But it sounds like it was amazing.
Oh my gosh, that's too funny. Yeah, I think artists really, really like Italy, the big renaissance in the art over there. It's wonderful. Yeah, you'll have to go by yourself or of course include your parents, but you'll have to go.
And then our final question is, we were wondering if you had a favorite thing you like to do during the fall season.
Other than running, because I've talked about that, I just like going for walks, like especially in Vancouver, it's so lovely just going for walks and then getting like a little coffee or like a little fancy drink or something and then walking along the scenery here.
Are you a fan of the fall fancy drinks? Do you dabble within the pumpkins?
Like pumpkin itself, I love, love, love. I haven't tried like any of those like pumpkin spice lattes or anything, but I should. Yeah. Do you guys like them?
Not to, perpetuate any stereotypes about myself, but I do. I'd like to say I don't, just to feel, different and cool, but I do.
I mean, there's a reason why everyone likes them, so I don't think it's lame at all. I think it's great. There's a reason.
Thanks for that. Thanks for the support. Okay, well, on that note, I wanted to say a huge thank you to you, Dr. Nadia Kashetsky, for taking the time to join us today on our podcast. We are honestly so appreciative for everything that you shared with us today about your journey and about your advice with CaRMS in general. And to all our listeners, thank you so much for listening. We hope this episode gave you some more insight on what it's like applying to dermatology and the specialty as a whole. And we hope to have you back here for our next episode. If you want to keep up with our podcast, offer any feedback, or know when our next episode is posted, you can follow us on Instagram and Twitter at Skin Curriculum, or visit our website at www.skincurriculum.com. Otherwise, we hope you enjoyed this episode of Dose of Derm, and we hope you all take care.